Thank you all for being here tonight. That's a huge, it means a lot to the group that is working so hard to make it a positive impact on our community that you chose to spend the night with us. And I know 6:30 is a lot of dinner times, but we wanted to make sure that you had a chance to get in and get home before the end of the night. So we're going to start, and we're going to hard stop at 8 o'clock. So you can look at your schedule and say, I wonder when this is going to be over. It's going to be over at 8 o'clock. I want to thank, first of all, the Clippard family for allowing us the space tonight. This is a huge help to an event like this because you just don't have room for 150 everywhere. And the Clippard family stepped up. Mr. John Campbell, president, said, you know what, we want to be involved. We're a part of our community. Use our facility and make it happen. So we greatly appreciate their willingness to work with us tonight and give us this space. I also want to thank the members of the Colerain Township Community Health Collaborative. Ms. Carol Baden from the Community Recovery Project in Southwest Ohio, People Advocating Recovery. Carol, thanks for being here tonight. Pauletta Crowley and Ms. Shonda Moore from the Northwest Local School Districts. Jennifer Clippard Connon, Jean Hayes, and Lynn Kerr from the Clippard Instruments Human Resource Department. Captain Will Mueller, EMS Coordinator from Colerain Township Fire and EMS. Ms. Emily Randolph, she's the Colerain Township Human Resource Director. Lieutenant Jennifer Sharp from the Colerain Police Department, and Detective Day Hubbard, and Officer Kyle Frandoni, and Officer Jamie Penley from the Colerain Police Department. These folks make up our Community Health Collaborative to address the important issues when it comes to public health in Colerain Township. And the most important issue that we face as a community and as organizations, from the private sector to the school districts to the local government, say that this issue of opiate abuse and heroin is something we need to be working collaboratively together and make the most positive impact we possibly can. I want to thank the moderator, Pat Bell from the University of Cincinnati. I want to thank our guest speakers for coming out tonight. Shonda Moore from the Ohio Attorney General's Office, Mr. Alex Schering. They're going to speak tonight in a little bit. And probably the most important piece of the whole evening is the restrooms are out the doors to the right at the white table and turn right. The men and women's room is there, so certainly feel right. And the water is over here on the right-hand side, my right-hand side, and your left-hand side. So feel free to get up and move and take care of the business that you need to take care of. I said again, we're going to hard stop at 8 o'clock. We respect your time, but we're going to be around. If you choose to stay for ask questions and things of that nature, feel free. We're going to be around. We want to make ourselves available to you. We want you to understand how important this is to us, and that we value the fact that the folks that live and breathe and work in Colerain and play, they mean something to this community, and we want to make sure that they're taken care of. When we speak this evening, I want you to hold your questions. You all had an opportunity, or if you didn't, you might have a white index card. Write your questions on the index cards. And when we get done with the speakers, we're going to take a couple minutes so people can stretch their legs, get a bottle of water, run to the bathroom. You'll see white boxes and black boxes throughout. Just drop those questions in those boxes, and we'll get those questions together so we can best use our time as we move through this event. So we're asking the questions that you want answered, but we want to maximize our time. And everyone that's here tonight, Lieutenant Sharp, Will, Alex, Shonda, and Carol, we're going to be there to answer your questions. We want to make sure that you have the time to do that. We believe that this will streamline the process. But one of the important pieces for us tonight is I want you to understand that the Board of Trustees, Ms. Melinda Reinhardt, Dennis Dieters, and Jeff Ritter, along with Ms. Harlow, and I think I saw Ms. Heather Harlow in the audience, so thank you for being here, is they approved this proclamation last evening at the trustee meeting. It's Colerain Township United Against Opiate Abuse and Heroin. Whereas at least 2 people die from a prescription painkiller or heroin overdose every day in the 20 counties that surround Cincinnati. Whereas Colerain Township police and fire first responders experience close to 150 opiate overdose-related emergency medical calls in 2014. Whereas our rates of new hepatitis C infections are higher than the national average. Whereas our law enforcement officials are seeing higher rates of crime related to heroin. Whereas the number of children being born needing to withdraw from opiates or heroin continues to rise in our local hospitals. Whereas community members have come together to address this epidemic from across the region. Now therefore be it proclaimed that the week of February 23 through March 1 of 2015 be the United Against Opiate Abuse and Heroin Week. All over the region we'll use this week to develop solutions to this problem and understand the role that each of us can play in eliminating opiate abuse and heroin from our communities. Approved this 24th day of February 2015. And Jennifer and I had the honor of attending the Opiate Summit in Northern Kentucky for the last 2 days, Monday and Tuesday of this week. And we stood together with about 120 folks from all over the region that made that same proclamation to commit this week to being proactive and being partners to say we're done. We want to be part of the solution and no longer part of the problem. And we added where the sign-in is, we took the calendar and kind of stole it from you, Ann, but we wanted to let you know that there's a lot of events that are going on through this week, and we're at Wednesday. There's still Thursday and Friday, and maybe there's an event that occurs Thursday or Friday throughout the region that maybe would be beneficial for you to attend. So we wanted to make sure that you had that information available to you as we move forward. So in reality, why are we here tonight? I have to be honest with you. My name is Dan Malloy. I'm the Director of Public Safety for Colerain Township. I was a police officer for 25 years. I was the police chief for the 6.5 years prior to my becoming the Director of Public Safety. And I've had the opportunity to get some education. And over the last year, I've been involved with some really tremendous people that allowed me to understand the progression of this disease and the situation that our society and our community is facing when it comes to this disease. And as I've learned, it became real quickly observant to me that this is a problem. You say, well, no kidding. That's why we're here. But in the terms of policing, we commit to ourselves as an organization as a problem-solving agency. That means a problem in the law enforcement terms is defined at any incident, any two incidents that occur within a community, that a neighborhood or a community would say, that's a problem, and they expect the police to do something about it. That's a problem. And you'll see as we move through the data for Colerain Township that there's more than two. And the reality is, when you look at things as a problem, and how do we define that, and how do we work through that, it changes our perspective. It means as we solve a problem, we got to work collaboratively. We got to bring people like we have tonight to the table. Like you mentioned, like with our collaborative, we got to bring the table. So we said, you know what? We need as many people as we can. So we reached out to the Hamilton County Department of Public Health, because this is a public health issue. And we joined them as a We Thrive community just last month. The board signed the resolutions to say, you know what? We commit to this, and we're taking down the community health path. And our community health path is the opiate issue. So we're going to use the resources from the Public Health Department. We're going to use whatever resources that we can identify that are willing to work with us to allow us to think differently, challenge ourselves, and say, you know what, how can we get the better result that we need to have? Because what we've been doing for the last 5 years, 6 years in this region, has been a whole lot of arrests and then a whole lot of response and not a whole lot of change. And if there has been a change, and you'll see from the maps, it looks like the change is for the worse. So that famous quote, you just keep doing the same thing over and over and expecting a different result, well, we're beyond that now. And we're going to do something different. We don't know, I'll be very honest with you, standing up here tonight, we're kind of in different waters, you know, but we're not afraid of that. No one in here is afraid of what we're working to accomplish. We accept the challenge and we're going to attack it. And we're smart enough to know we don't know all the answers, but we're smart enough to ask the right people and get the right people engaged in the process. So as we've moved forward, we've gathered this group together, and we want to be driven by the initiative. So we haven't spent a whole lot of time talking. We've spent a whole lot of time understanding that we need to get moving forward, and we want to make sure that our community understands the commitment that's being made by Chief Denny and his police department, Chief Cook and his fire department, our township as a whole. This is our community. We want to work with the folks that live in here and work here and commit to this community saying, this is my home. This means something to me. Well, it'd be nice to know that somebody from the community actually cared. And that's kind of an understatement, but the reality is we certainly do. And we want to be a partner in this to understand how we can get better. So I'm just going to turn it over to Captain Mueller and Lieutenant Sharp, and they're going to kind of give you a perspective from the police and fire so you can see the numbers and understand where we are in respect to response. But the one thing that I'll take away before I turn over the mic is this is not the end. You say, well, okay, great talk, because that frustrates me to no end, a lot of talk and not a whole lot of action. The group that I represented to you before, we're meeting next Tuesday. We've invited one of our politicians to sit at the table with us as we talk through some difficult issues. We say this is something, we're not going to turn our head from this. We need to be open about it. We sit down Tuesday, we're going to talk these things through, we're going to talk of some initiatives that we have, some ideas that we have in respect to changing expanding the response model. I mean, we respond, just shortly, we follow up all domestic violence calls with an additional follow-up. If a child goes missing, we follow that event up with the family to make sure the resources are there to take care of them. We follow up Alzheimer's events, special needs events, things of that nature. We do that. That's part of our working practice. It's been part of our philosophy for a long time. We want to figure out how we can, as partners, take our police officers, our firefighters, and our resources and provide follow-up to those overdose events to make sure the family has the resources and maybe answers to some of the questions, or even the affected member of the community that had the incident can say, you know what, I have a couple questions, or maybe they don't, but maybe they do. You know, how can we be there for our community to say, you know what, will it work? I don't know. But I do know if we never do anything differently, we'll never accomplish any success. We've had great success in our domestic violence follow-ups with helping those victims, those survivors. We've had great success with our missing persons. We've had success with our special needs families. Why would we not try? Again, I don't know what the results are going to be, but we're going to do things differently. So in the end, we got a lot going on. We have a leadership retreat next Friday and Thursday and Friday. This is on the agenda. This issue is on our agenda for leaders within our township as government leaders to say, okay, this is what we've learned. This is what we're thinking about. Are we supporting each other? Are we in this thing together? So we got a lot, our brains are, that hamster is running really, really fast in my brain right now as we move forward on this. So again, thank you for being here tonight. We appreciate everyone's willingness to come out. We hope that you get something from this. There's also some resources on the tables out there. We've got some great partners out here tonight. But there's some information in respect to when Captain Mueller and Lieutenant Sharp talk about the packets that we give out, those packets are on the tables back there so you can see what resources we're providing our families. You can see what information is from the Ohio Health News when they did the study back in September of 2014 on the issue across the state. So you can see how we compare, because I'll tell you, learning from the last 2 days, yes, we have a problem, but we're not in this alone, which makes you feel we're not in this fight alone. It's all across the region, and we got a lot of good people that were willing to commit to the effort. So again, thank you very much, and I'll turn this over to Captain Mueller and Lieutenant Sharp.
Thank you all for being here this evening. I am Jennifer Sharp with the Colerain Police Department. I've been with the department for 14 years, and I've always been of the mindset of community-oriented policing. So when asked to be a part of this group and a part of this team in the effort to go after the opiate epidemic that we are seeing here, I was all in. So with that same mindset, comes the responsibility of not only to just make the arrest for the drug paraphernalia, the drugs, but on top of it being an arrest, it's pointless. If you don't go that step further to actually find and assist that person with the proper need, the proper help, the proper care that they're going to need thereafter, well, then we're just spinning our wheels. We're not making a difference. We're not making change in people's lives. And to watch these families of the person that has this disease, because that's exactly what it is. It's a disease. The addiction is a disease. And if we're not out there actually trying to help this family and the individual to recover from that disease, then what good are we doing at that point? Now, in 2014, we made 126 drug possession arrests, not all necessarily heroin. We had 20 trafficking of drug arrests in 2014. Of all of those arrests, 47 different occasions did we actually take in property that was heroin and or the needles. With that said, that's very well just 47 families that we know of that we can go out and try to assist and try to help. And if it gives you any idea, in 2013, there were 28. So we've almost doubled within that year. So the heroin and the opiate epidemic is here. In the state of Ohio, which is across the nation, one of the higher rated, Ohio, Indiana, and Kentucky, has a higher rate of overdoses for drugs, drug overdoses. So we know that it's here. We know it's in our state, and we know it's here locally. In the state of Ohio, actually, they state that, from my understanding, it is 5 Ohioans die a day. 5 Ohioans die a day. That's 1 every 5 hours. Now that was the actual statistics back in 2012. We know it's risen since then. They don't have the statistics for last year, but I'm sure the number is going to be a lot higher. That in and of itself is sad and a scary thought. This disease has to be tackled, and as a community-oriented policing officer and department that we are, this is something that we plan on as a community, as a group effort, to go after this disease and help those that are suffering from it and their families.
Thank you, Jennifer. And again, thank you all for coming tonight. It's fantastic to see the seats filled up. Again, my name is Will Mueller, a captain with the Colerain Township Fire Department. I'm in my 19th year with the fire department. I've seen a lot over that course of time. Haven't seen everything, nor will I ever claim to. So just to give you an idea, a little bit of my background. A couple things I'm going to discuss with you is a culture within the fire service that needs to change. I'm going to touch on that, what I mean by that a little bit more in depth. I'm going to talk a little bit about where Colerain was in terms of opiate overdoses and what our plans are moving forward. We'll talk a little bit about where we are right now and what our plans are for the future. I'm not sure if everybody can see this or not. A little formatting issue with the slides here, so I apologize for that. So, where we've been, where we are, where we're going. Okay, first of all, when I say we need a culture change in the fire service, this is something that we've implemented here at Colerain. What do I mean by a culture change? Well, that's our approach. That's our approach and our thought processes and how we think about people who are addicted to opiates. What causes this poor demeanor or towards these addicts? It's probably the fact that many times we get called out at 3 o'clock in the morning after making 30 other runs that day. And it's the same person that we just revived last week. You do that time and time again, and you become a little callous. And I'm embarrassed to say that. I was there. I was there. I was there up until 2 years ago. And I made one run that changed that point of view, probably forever. We got called out to a 20-year-old cardiac arrest. It was a female. We arrived at the residence. The person that was there with her wouldn't let us in. with police assistance. We forced entry. The gentleman that was there in the home said, I tried to wake up my girlfriend. I was just talking to her. She won't wake up. I think she's dead. We went into the back room. Indeed, there was a 20-year-old girl laying there in the corner. And indeed, she had passed several hours before. When I looked down and I saw the girl, who did I see? I didn't see a stranger, but I saw my daughter. And I thought, one bad decision led that girl to the corner of that house and ultimately to her demise. That changed me forever. It was that run that changed my point of view. That helped me begin to change the culture within our fire department. I met with a firefighter from Middletown today who asked me the question, how do you achieve buy-in from your firefighters? How do you get to change that culture? You do it one overdose run at a time. I'm going to talk a little bit about what we do with these overdoses and how this culture has changed as we move forward. Where we have been, I know, again, some of the wording here is somewhat small. 2011, Colerain Township Fire and EMS responded to 51 overdoses, opiate-related. Look what happened in 2012, 115. 2013, 116. 2014, 141 opiate overdoses. That's just Colerain Township. That's here. That's right here. We just received this data today from the Ohio Attorney General's office. What they did is they plotted a map for us. We submitted our run data and the pickup locations for these opiate doses, and they plotted them for us on this map. I'm going to try to get out of your way so you can see here. This is 2012. 2013. The size of the map changes a little bit, but this is something impressive that Director Malloy pointed out. We really haven't had a chance to analyze this data because we just got it this afternoon, literally. So we haven't had a chance to really look at it. But one thing that was very stark was, what do you notice? There's a spread. And I'll go back through them again, and you notice the spread. And what we realize is that this problem is not staying localized to certain parts of Colerain anymore. It's spreading out. And there's 2012 to 2014. These are the emergency medical responses, again. Where we are currently, that's where we've been, where we are. We started handing out these recovery packets that were put together by the Community Recovery Project, headed up by Carol Baden here. And we joined up with her and we said, we want to do something. We don't know what it's going to look like. We don't know what it's going to mean. We don't know what impact it's going to have, but we're going to try this. We're going to hand out packets based on our professional assessment. When we arrive at the scene and we determine that there's a problem, we're going to hand out this packet. We're not guaranteeing that they're going to reach out for help. We're not guaranteeing that the help in those packets are going to be able to give them the help that they need. We're not guaranteeing. We're not claiming to be therapists or any type of professionals in this area. We're just saying we want you to get connected to help. That's what we're saying. So we're handing out these packets. This is what the packet looks like here. We've had some small wins, and I'm going to elaborate that on that here in just a little bit. The Colerain Community Health Awareness Group formed. This is where we're at today, right? And Director Malloy touched a little bit on that, so I'm not going to get too much more in detail about that. And we formed a lot of partnerships. One thing I've learned in this position that I assumed about a year ago as captain over the emergency medical services operations is that if we want to be successful in what we do, we need to have partnerships. And we've got some great ones in this Colerain Community Health Awareness Group. And I'm looking forward to what the future has in store. That's where we're at right now. I want to talk a little bit about that recovery packet distribution. We began that campaign in August of 2014. Now, when we kind of made a directive that we were going to hand these out, I got a few questions from the crews. Really, you want us to hand out this packet? I mean, how effective is it going to be? We make one run and we hand out one packet. I don't know, guys, but we're going to do it, and we're going to see what happens. We're going to see what happens. I had a couple guys give me a little pushback. That's okay. It's a culture change. It doesn't happen overnight. We're going to give it some time, and we're going to see what happens. One of the guys that gave me pushback 3 weeks ago called me and said, hey, I wanted to let you know we're out of packets. We need to hand out some more. Here's why. 3 success stories out of 50 packets. We've handed out over 50 packets since August of 2014. We track them in our EMS reporting software now, so we know how many we're giving out. We've had 3 success stories, and what I mean by success stories is we've had people call us back and thank us because their loved one has now gotten the help that they needed. I don't know what that number means. I don't know what 3 means. I don't know if 3 is great. I don't know if 3's insignificant, but you know what? It's 3. And I'm happy, and I'm pleased about that, because that's 3 more people that may not have been connected to resources had we not been handing out those packets. So we're pleased, and we're moving forward. Where are we going? We're going to continue distributing out these packets. They've been effective. What's the goal? More success stories, just like we've had. Implementation of a narcotic overdose refusal form. What happens when we arrive at the scene of an overdose and we give Narcan or naloxone, that medication, that magic drug that reverses the effects of the opiate, and these people come back to life, essentially? And they're alert and they're oriented. What happens when they don't want to go to the hospital? We can't take them. That's a problem. That's a problem. All right? So they have the right to refuse care. That's their right. Right? We're going to come up with a refusal policy. We're going to have a checklist of things that we're going to go over to make sure that they know so we can educate them, to try to persuade them to go to the hospital. Again, the goal, reduce risk of patient refusal transportation. We're going to push for education on behalf of our paramedics to push smaller doses of Narcan. And we're going to push for a protocol change for 2016. Right now, protocol says we can give 0.4 milligrams to 2 milligrams. A lot of our guys will go for the gusto on the first dose, 2 milligrams. These patients are going to wake up. They're going to become alert and oriented very quickly, like giving sugar to a diabetic. And then they're going to want to refuse care. This happens very often. All right? So we're going to start training our paramedics. And as long as their respiratory status is fine, we're just going to keep breathing for them. As long as their oxygen saturation is high, we're going to breathe for them. We're just going to give them a little bit of Narcan. We're going to transport them to the hospital before they have a chance to refuse. Right? So we're pushing for that change. All right. At this time, I'm going to pass it off to Danielle Smoot from the Ohio Attorney General's office. We're very glad to have her here. So, and again, if you have any questions for myself or Jennifer, Director Malloy, you have those cards, and we'll get to that question and answer after the guest speakers. Thank you.
Well, I'm going to stand behind here because I have my notes, so I don't forget. I was asked to come to speak to you tonight on behalf of the Office of the Attorney General, Mike DeWine, but I'm also here as a parent, and I am extremely honored to represent both roles. I'm here because my son passed away 4 years ago from a prescription drug overdose, and I can tell you that nothing in my life prepared me for that moment. My son, Cole, was an incredible young man. He was incredibly intelligent. He was a wrestler. He was a loving brother. He was an amazing son. He was a piano player for 9 years. He had everything going for him. I mean, nothing indicated in his history that he would make a choice like this. In fact, if you look at the 40 developmental assets, he had most of those. So nothing could have prepared us for this moment. In fact, to say that we were shocked, it would be a gross understatement. So what happened? It was 4 years ago this month that a large amount of drugs made their way into our local high school, and these drugs had been prescribed to a woman with cancer. And when she had passed away, her husband didn't know what to do with the medication, so he stuck them in a large box and put them in the back of a closet. And through various means, we don't exactly know how, they were stolen and brought into the high school, and 2 young men distributed them on a Thursday morning, and quite a few students had taken them that day, but my son didn't get them on a Thursday. He received them on a Friday afternoon, he went about the rest of his day, and that Friday evening, when I picked him up after wrestling practice, a little bit later that night, I noticed that he was under the influence of a narcotic. So my husband and I took him to our local emergency room, and despite asking very pointed questions to our doctor and having him reassure us on multiple occasions, we were told that he was out of the danger zone, and we were sent home. So thinking that the very best course of action for my son, we all went to bed thinking that he just needed to sleep off the effects of the drug. Just a few hours later, when we went to wake him up, we found that he had passed away in his bed. An autopsy and a toxicology report showed that Cole had taken just one pill. Just a single dose, a one-time ingestion, ended his life. This one bad decision absolutely shattered my family. And I would love to be able to stand up here today and tell you that this is an isolated event, but it's not. What happened to my son happens all the time. Every single day in the U.S., 120 people die from a drug overdose. We know this. We know the statistics. We see it every day on the news, and we read about it in the paper. Now, I'm going to jump on my soapbox here because obviously with my family's history, this is something that's very near and dear to me. I think that we've gotten away from the message. Back in 2011 when this happened, it was called the Opiate Epidemic. And we were told to get rid of all of our unused and unneeded medication, and we did a wonderful job of that. We passed out the prescription drug drop boxes. They showed up in the law enforcement agencies, and we cleaned out our medicine cabinets, and we did a really good job of that. But I think that we stopped. And I'm going to put things in perspective. Every single day, 7,800 people try an illicit drug for the very first time. Every single day. And of those people, over half of them are under the age of 18. Now, of the drugs that they take, 1/5 of those will be a prescription drug. And this is very important to note because statistically, the history shows that 19 of those drugs, people that take non-prescription or prescription pain pills, they are 19 times more likely to try heroin. And of the heroin addicts that are addicted, more than 50% of them started with prescription pain pills. So that link between the pain pills and heroin, it's irreversible. It's irrevocable. It cannot be broken. But that's not what we're seeing in the news any longer. Back in 2011 when my son died, that's all you saw about. Today, we're not seeing it in the news. We hear about heroin, and absolutely we should hear about heroin. It is a scourge. It's killing our people. Yes, but we don't hear about the pills. So I think that we patted ourselves on the back and we said, good job. We can unlock our medicine cabinet. We can put our guard down, but we can't because we have not done the job. So I'm going to step off my soapbox now, and I'm going to put on my hat for the Attorney General's office because I was also asked to share what we've done collectively in the office. And so in the past few years, the Attorney General has revoked the license of 15 pharmacists and 61 physicians who have improperly prescribed or dispensed medications. And that's huge. It is not an easy task to revoke the license of a physician. And of those physicians, 51 of those licenses were permanent. That's a very big deal. In partnership with the Ohio Department of Health, it was ODATIS, but now it's Ohio Mental Health and Addiction Services, and Drug Free Action Alliance, the Attorney General's office purchased 67 of the prescription drop boxes, and they distributed them throughout the state, and more than 26,000 pounds of unneeded medication have been disposed of. And the Attorney General also has awarded $10.7 million to the DARE program. And I want to take a moment because I know that this tends to be a little bit of a divisive issue because when you talk about DARE in a community, people are like, oh, DARE doesn't work. But that's the DARE of the 1990s and the 2000s. DARE today is a very different thing. One of the very first things that the Attorney General did was he mandated that anyone who is receiving a funded program implement a prescription drug abuse prevention lesson, as well as if you were if you were doing a curriculum, you had to use an evidence-based curriculum, and if you were not, you had to go before a DARE review team, and you were provisionally accepted if it met certain criteria. And this next year, if it's not a evidence-based curriculum, you don't get approved. So what was happening in the past, it's not that way. So what is being done now, what is being taught to your children is absolutely evidence-based, because prevention is a science. Okay. The Attorney General, in conjunction with the Governor Kasich, held a heroin summit in which over 40 schools came together to learn about what they can do and how they can address their population and offer practical solutions. He also held 13 town halls across the state to find out what is and what is not working in the communities, and I'll tell you a little bit later on how that is able to help your community here. He also organized a coroner's review. One of the biggest challenges was getting information from the coroners. How do we really know how many people die daily? And how do we know how many people are dying from heroin when we don't have a standard reporting? And when not all 88 counties are reporting on overdoses, especially in relation to the opiates. There's been a very big push for training and education, extensive training for law enforcement, but also he produced a naloxone training that's not just for law enforcement, but for anyone who is interested, because it's not just for law enforcement, it's for lay people as well. And just recently, he petitioned the manufacturer of naloxone for a $6 rebate for anyone for law enforcement and other dispensing agencies. So what are we doing now? The biggest part of what our agency is doing, I say our agency, what our office is doing, community outreach, is we are actively engaged in the communities, because we realized that it's not going to be solved, this problem is not going to be solved from a federal level, it's not going to be solved at the state level, it's going to be solved at the community level. It's going to be solved in rooms here, and it's going to be solved with people like you. And so Attorney General Mike DeWine knows that. He stated at one of his meetings, and I mean, he's an incredibly smart man, he said, we're not going to legislate, we're not going to prosecute our way, and we're not even going to treat our way. The way we're going to solve this problem is we're going to have to prevent it. And we're going to have to come together, all of us, every sector of society has to come together. So one of the things that we do a lot of awareness events like this, but one of the things that we do, we hold community meetings. And in those community meetings, if there is an interested community, we will go there and we will invite, we work with a group that invites us, and we'll send out the letters with the Attorney General's headline, or what is that? Letterhead, there we go. To the people that have been identified that are the movers and shakers in the community. And it's amazing how many people will respond when you have the AG's letterhead on that, rather than just an interested party like myself. And so we get them together, and the really important thing for this is that we facilitate the meeting, and the community is the one that develops their own strategic plan and action items to identify what they want to accomplish in their community. And we're only there to help connect the dots on the resources that they already have, as well as to facilitate those from the state level and to bring them down. Because we've been in communities that say, well, we need this, and we need this. And they didn't realize that when you bring everybody from the community together, they already had it there. They just didn't realize. And so that's something that we as an organization are able to do. And so that's something that we are doing currently, and as far as what we plan on doing, we're going to increase our focus on staying at the grassroots level, because that's where the success is. That's the key. And in summary, our goals are simple. We have two. One, we need to keep people from dying, and two, we need to keep people from becoming addicted in the first place.
I'm going to stay sitting. Is that all right? Nobody cares? Okay. I feel like there's tension in the room tonight. I'm not really sure why. Okay, so my name's Alec. I'm not anything special from the AG's office or a politician or anything. I'm in recovery. I'm in long-term recovery. So what that means is that since May 15th, 2012, I've had no mood-altering chemicals. I want to say something real quick. I've heard a few things tonight that really touched me, and that was addiction is a disease. I've heard that since I walked in the door tonight. I walked in the door before everybody else. There was a lot of police officers here, and I don't know if anybody else can relate to it or not, but when you're an addict and you walk into a room full of police officers, it is not a comfortable feeling. And tonight I walked in here and I felt welcomed, and I felt loved, and I felt like I was understood on another level, which is a really – can you hear me? All right. It's a really grateful feeling from my perspective or whatever. So, but I also heard that a culture change has to happen, and that is really at the center of what we're going to try and do. People they got to start to understand who we are as people. If I told you that not 4 or 5 years ago I was robbing people out of their houses, putting dope in my arm, stealing from my family, getting locked up in jail on a weekly basis and all that stuff, you probably wouldn't believe me, you know. But today, you know, I look back at that and I see who I was and who I am today and the process that it took to get to where I'm at today. And I want to say it's hard. It is hard, and it's a maintenance thing. It's something I'm going to have to do the rest of my life, and I understand that today. But it took a lot of consequences to get to that point. That's something I want to say, too, is that a lot of people, you have to understand that when somebody wants help, that is really the precipice of where we have to help them, and that's when they want it. Sometimes there are people out there that don't want it at that point, and they haven't been beaten down hard enough yet. And I was at that point when I hit jail. Is it really? Oh, wow, that's loud. I don't like that. I'm uncomfortable. Okay, so I got to that point when I got locked up. A real quick short story about myself. I'll tell you my history. I'm a normal kid from a normal family. There's no addiction in my family. There's no alcoholism. Hi, Lindsay. Wow, it's Lindsay from the old days. So I haven't had any kind of experience in the drug world prior to becoming an addict. I drank like a regular kid does through college. I didn't have any problems with it. I graduated. I did everything I was supposed to do. I broke my back. I used to be a firefighter, which is really weird. I broke my back, and I fell. And I went to a doctor, and the doctor gave me some Percocets, and I'll never forget the first time I took it. When I took it, it didn't affect me like it usually does some people, which is where they get kind of sick or itchy or don't like them or they flush them down the toilet. I've heard that 1,000 times. That wasn't in my vocabulary. When I took the first one, that was the history of when I started being an addict, and I couldn't put them down from the day after that. And it slowly got into heroin, and the jump from prescription use into heroin is not this crazy jump that everybody tells you about. Heroin is readily available. It was easier for me to get heroin than it was marijuana, if that makes any sense. And I know that sounds crazy, but that's the truth. And everything I tell you tonight is from pure experience. I'm not a doctor. I'm not a therapist. I don't know any kind of stats, but I do know how to stay clean. And that's why I come to these meetings, is to share my experience a little bit. I work a 12-step program. I'm not ashamed to say that. It took a spiritual awakening. It takes a guy knowing what he's doing. It takes step work in my life. The basis of addiction is really simple. It's obsession and compulsion. That's it. My brother does suffer from OCD, which is obsessive compulsive disorder, which I think I do suffer from a little bit. It ties in with my addiction. But today, I'll tell you a little bit about what recovery is like. Recovery is crazy. All the emotions that you didn't feel while you were using, you start to feel when you hit recovery, which is why it's so hard to recover. When you stole from your parents and you did all these bad things, and you see the prosecutor more than you do your parents, and you see lawyers more than you do anybody else, and then you get clean, and all of a sudden people tell you they want you to do good. And it's really hard to do when all you can think about is all the bad stuff you've done. So when I heard the police officers in the fire department talking about making follow-up visits to people's houses for an overdose, that's mind-boggling. That's I'm still trying to process all of that. When I showed up, they were telling me the ideas, and I was like, whoa, whoa, whoa. Like, this is really forward-thinking, and but it's needed. And I wouldn't be surprised if somebody else took that idea, like me, and took it to my little hometown out in Indiana. But once you get into recovery, what's crazy about it is you can obsess on anything. So I'll share with you guys, I'm going to get honest with you guys on what I've obsessed on since I've become clean. When I got clean, I put the drugs down. I haven't touched them since. And since then, I've had to do a maintenance program on who I am as a person. So when I got into recovery, the first thing I obsessed on when I got out of jail was women. Okay? I had to find self-acceptance through other people. That was a problem for me. My sponsor pointed that out. I worked some steps on it. I don't suffer anymore. The second thing was buying stuff. So I would go on Craigslist, and I would find some bike for $3,000, and I would get the guy all the way to the point where I was ready to buy it, and then I wouldn't text him back. And I don't know why, but that gave me a rush of some sort, okay? And then I got into, like, extreme stuff. So I went and rappelled off a building. I did all this crazy stuff, and then I stopped doing that, too, because I don't like it. It's not what I want to do. But it gives me this little rush, and it gives me this feeling of replacing the dope, if that makes sense. But the cool part about it is you can work on all those things and never have to do them again. You know what I'm saying? So today, what I really want to get across to you guys is that the disease of addiction doesn't leave. So once you put down any kind of drug, doesn't matter if it's alcohol, bath salts, cocaine, doesn't matter what it is. Recovery is recovery, and addiction is a disease. And it really is a disease because I still suffer from it today. I obsess on all kinds of things today, but I keep talking to my sponsor about it. I talk to my other sponsees about it, and I work steps about it, and I do all the things I'm supposed to do. And I still suffer from it, but I don't suffer from it to where I have to use anymore, right? And the solution for this problem is really based in people like me. And I know there's a few other people in here I've seen at meetings. I'm not going to point them out because some people like anonymity. But I share my story in hopes that you guys can understand that the people that are doing the deal right now, which is staying in recovery, staying clean, doing the right thing, helping other people, staying in service work, and all these other things, that's really a solution to this problem, is that we know how to stay clean, but nobody wants to access what we're doing. And the reason they don't want is there's a lot of anonymity involved. And that's because 12-step programs, history-wise, have always been anonymous. But there's a huge movement across America right now to relieve the anonymity. And the reason for that is they could have easier access. I had a lady reach out to me last week. I started a nonprofit in Indiana. It's a small nonprofit. We don't make crazy money, but we help people. We get people into recovery, and that's all I want to do. So I'm happy with where we're at. And she contacted me about her sister is in prison. She cannot really get out of this program without a sponsor and everything else, but her sister cannot walk up to a meeting and say, I need a sponsor for my sister. She needs help. She needs to be connected when she gets out, all this stuff. That's just not possible. And the reason for that is most meetings are closed, which means if you don't have the desire to stop using, you shouldn't be here. And I see the uses for that because there's a lot of people that are ashamed of this disease, and there's no reason to be ashamed about it. When I got out of jail, my parents weren't ashamed about it. I talk about using thoughts with my parents now. We have dinner table conversations about how bad my day was at work and how I would like to go to the bar and have a beer just like a normal person. And because we talk about it openly, there is no reservations left in my house. The disease is there. It's not hard to talk about, if that makes sense. And my brothers know about it, so I don't go to parties. I don't go to weddings and people offer me beer. People know who I am. So it's not as much of a challenge as people have to make it at this point in time. But she reached out to us or whatever, and we got her a sponsor. A friend of mine was like, yeah, I'd love to. Here's my number. Here's my name. Here's my address. And her sister's going to get out of prison now, connected, go to a meeting, call somebody, and be part of the solution. And if not, there was talking here too earlier about, people that were getting out of jail with no support system. That's sad. That's super sad. I can't tell you guys how today I can sit in this room right here, and at some point in time during this presentation, I can feel lonely, if that makes sense. And I know it might not make sense to everybody, but it's a lonely disease, and when you get out of that was my first time ever getting in that much trouble. I've been in trouble a few times, little DUIs and drinking and driving and being stupid, but this was a big guy felony. It had a 20-year charge. My parents were shocked. I had a $100,000 bond like I was a murderer. It was crazy. And that was enough to get me in to some kind of intervention. Usually that's what it takes, maybe a consequence or a spiritual awakening of some sort or some kind of loss or something like that to get you into recovery. But I want you guys to know, too, that we're going to do this question and answer session. I'm not offended by anything. If you have kids that are using, if you have some deep questions that you want to ask them. This is the time for everybody to get honest. I've been to enough of these panel discussions where people are kind of reserved and they don't want to ask these questions, but afterwards they'll pull me to the side and ask a real question. And what you don't understand is that your question could save somebody else's kid's life because they need it too. And, I was talking to somebody right before this about my job and where I work, and there's people using it at my job. There's people using everywhere. It is all over the place. It is rampant. And the crazy part about it, nobody wants to talk about it. Everybody wants to make it like it's a choice. I never told that doctor to give me pills, and I didn't know if I took one of them for the first time in my life that it would lead to heroin and me putting a needle in my arm. I'd have told you were nuts. My parents would have told you I was nuts. Everybody would have told you that's crazy, that's not my child. He's a college graduate. That was the one that they always threw out there because I was the first kid in my family to ever graduate college. So I want you guys to know that there is no stereotype for an addict. You don't know what they look like. You don't know how they act. You don't know anything about them, and if it hasn't touched your family yet, it's on the way. It's coming, and the reason it's coming is because you can't hide from it. And people that we trust are starting the disease without even knowing it. And I believe wholeheartedly, and this is just my experience, I was born with it. Alcohol was not my choice. Opiates. When I got opiates in my system, it was history, and it's that simple for me. But I want you guys to know, too, if you do ask any questions, ask away now. You guys have got some really forward-thinking people. This community is doing something that I've never seen before. And I've been asked to speak in a lot of places. I go to a lot of places and speak. And I've never seen police officers make me feel so welcome. I got a coin. I don't even know where I put it. I got a coin for being here tonight. And I'm humbled enough to understand that I'm just a drug addict in recovery. And I understand that I have some humility today. And to get a coin from a police officer saying thanks is an amazing, amazing feeling, you know? And from the bottom of my heart to see you guys move forward like you are, and the community to show up this isn't happening anywhere else. This is not, my town is having, there's people posting on our websites. I got off Facebook a month and a half ago because I couldn't take it anymore. That's how bad it was. I deleted it. I'm done with it. I'm over it. I'm tired of the negativity. There was people saying, you know, this kid overdosed last night, and there were people making comments that he should just die, let him go, yada, yada, yada. And I think that's insulting, it's ignorant, and it's uncalled for. That's how I feel about it. I'm not ashamed of that. We're normal people. You know, my job where I worked took me back when I got out of jail with a felony because they believed in me. I mean, I've had a different type of recovery because I've been so honest with people and not ashamed of what was going to happen after that, because that's how my sponsor taught me to do it, you know? So I've been blessed or whatever, and I'm telling you guys, if you have questions, this is the place to do it. Throw your ideas out there. What Colerain is doing is amazing. I mean, for somebody to overdose and for a police officer and a firefighter to come check on them afterwards a few days later, that doesn't happen. That doesn't happen. That does not happen. When I got out of jail, 3 days later, my PO showed up with a cup and said, pee here. If you fail, you're doing 10 years. There was no firefighter. There was no cops. It was just a PO with handcuffs ready, expecting me to fail. Luckily, my parents had educated me on this. I went through a great program while I was locked up. It's called JCAP, Jail Chemical Addictions Program. It's an incredible program that taught me who I am as a person, what I suffer from, and how I can manage it. That's all it was. So if you have your questions, throw them out there. And like I said, nothing offends me. Ask away. We can save some lives tonight. It's a great idea. That's all I got.
Hi, my name's Pat Bell. I'm a friend of Carol Baden's, and I'm happy to be here with you tonight. I know there were index cards that were passed out as you entered. If anybody completed them, I'll walk around, or maybe some of the folks from the back can help me gather them. I'll read them, or otherwise I'll walk around with the microphone, and you can speak up and share your questions.
I used to work with Lindsay. That's crazy. I see like 4 people tonight, but I haven't seen in 5 years. That they probably had no idea I was there when I left.
Well, good job.
It's not that crazy. That's crazy. And you guys are doing some amazing, amazing things. Like we did.
We got everybody?
Please. Thank you.
Okay, thank you. First question. What is the Attorney General's position on needle exchange?
Tough question.
Wow. Well, sure. Okay. I have to admit that I am a very low person on the totem pole, so I cannot speak for the Attorney General himself, but I do know that the federal law prohibits needle exchange with federal dollars, so I don't know the answer to that. I know that is a very complex question. I'll say that. I know that it is something that is very definitely needed for harm reduction. I know that within the office, it is something that we support, our organization supports, but as far as financially supporting, I think that it's not allowable.
That's a really hard question.
Yeah, that is a very hard question. Yeah.
I just want to add real quick, with syringe exchange program, something you have to remember, well, you think this person's going in, getting a new needle, turning in an old needle, there is an opportunity for education, for prevention, for HIV testing, hepatitis testing. There are opportunities for naloxone kits. We have an opportunity of an active drug user to get information that they may not have available to them otherwise. It is very, very important that we understand long-term effects of active drug abuse with needles, dirty needles, is HIV, Hep C, which are already massively on the rise. Our healthcare system will collapse under the weight of these chronic illnesses. That's not going away. You don't get rid of HIV. Hep C can be treated, but it costs $100,000 for one treatment. It's a lot easier to give someone a clean needle, an education about what can happen if they don't use clean needles, than it is to deal with the long-term effects. Another dynamic is our nursing homes are filling up with young people, with folks who have used dirty needles and are suffering the effects of endocarditis, disability from overdose gone bad. So this is another factor to consider. Any opportunity for education and prevention needs to be utilized.
Okay, I will answer this question the way I answered it the other day at the summit. I'm going to tell you what I used to think and then how I'm transitioning. As a member of the leadership of this community, as a former police chief, I did my responsibility, and number one, and Chief Denny will say this, is the 60,000 people that live in this community. And we need to make sure that it's as safe as possible. And before you start to educate yourself on this issue, you believe that bad people are going to come to your town, exchange needles, then, use the needles again, commit crimes in your area, and then create havoc within your community. So this is one of those discussions we are continuing to have as we continue to educate ourselves on what this is really going to mean for our community. When you talk about the blood-borne infectious disease control issue, which is a totally different perspective, I have firefighters and police officers responding to these 150 so-and-so incidents a year. Blood hepatitis C is one of our major concerns. Keeping those men and women as safe as possible, that's responsibility of leaders. Makes you think differently. The types of needles that are being used chamber blood. In the exchange, there's a different type of needle that doesn't chamber that blood. I'm learning as we go. So there is no official stance. I'm not taking a stance on behalf of the township. I'm saying this is one of those things we're really, when I talk about what's happening as we move forward, when we sit back down at the table, these are those serious discussions as we evaluate the direction of our community. How are we going to do something? These are very tenuous conversations, and it scares a lot of people. So we want to have the information, as much information as we can, to give the people that make those decisions the right information and understand what it really means. Because I think if you don't educate yourself, you really just look at it as what I thought before, and Alec was just telling me the perception is not real. I mean, that perception that we're just coming in, we want the needle so we could, there's a whole process that goes along here, and as Carol said, there's an opportunity for engagement, opportunity for information sharing, healthcare issues, recovery opportunities, discussions, relationships, resources that, we're working through. We're definitely talking about it as we move forward. That's a serious discussion we want to have, but we want to have that. So we're not turning a blind eye. I'm not saying we're doing it, but I'm not saying we've said, no, we're not doing that. Because, like I said, 2 years ago when I was a police chief, I would have said, no, we're not doing it. Absolutely not. But, we were educating.
Okay, thank you. I'm going to read this next question as is, but then I'm going to broaden it a little. The question is, if Mexico and Afghanistan are sources of these drugs, what are we doing to eliminate these sources? I'm going to broaden that a little to ask, what do we know about the sources of the heroin that's coming into the community, and is there a way to address that?
Okay, I'll take that one. and I look over here at Detective Dave Hubbard was one of our members of our drug unit for a while, and Dave could speak eloquently on the issue of investigations, drug investigations, heroin investigations as it relates to the township and the region. As we all know, there's no border at our lines. It crosses over many demographics, and the relationship of the drug versus the people that you arrest, we could talk about that all along. That's part of the reason why we're here, is because that's not solving the problem. We also have an officer that is assigned to a federal task force in respect to drug investigations to understand the larger scope so we can be engaged with that process. And there's been investigations and arrests at a large scope with, you know, one of the countries that you referred to affected by that, involved us, and it didn't stop. And, you know, that's, if we personally, again, as I sit on my chair in a proverbial soapbox, that is an issue. But the problems that as I look out into the crowd, you're not really worried about Mexico or Afghanistan. You're worried about the loved one that you share a home with, or that you work with, or that you care about. What can we do to take care of that issue? The investigations are never going to stop. So in that respect, they're going to still, the federal agencies and the large-scale drug units are going to still attack this issue as they did yesterday. They're going to do the same thing tomorrow. They're going to investigate the criminals and the drug dealers and the traffickers to the best of their ability. They'll arrest and turn them over to the court systems. That's never going to change. We're going to commit to ourselves because that's a responsibility of law enforcement. But this is about transitioning from letting them do their jobs and then transitioning from a global perspective or a community perspective, say what else can we do? Because the investigations and the arrests are not changing the problem. So I hope that answers from my perspective.
I would like to add to that, though. One thing that has changed was the ability to charge with a manslaughter conviction when there was an overdose, and they can tie it to the person who gave that person the drug. And that was a very key piece of legislation that went through, because if you look at the Jalisco, Mexico heroin that is here predominantly in this area, that was something that was very important for that part of the investigation or investigative and prosecution aspect, because if you look at their culture, they come to the United States and it's not a centralized business model. It's very decentralized, and they don't sell heroin in drug gangs. It's very much that there's one person. They don't carry a lot of cash. They don't carry guns. They go into the suburbs, and that's why you saw the picture where the heroin is spreading, going away from the highways. And literally you call up your dealer and they'll drive it to your home. They'll deliver it just like pizza. It's, in my community, it's as low as $5, sometimes $10. And the difference is, for the Latino community back in Jalisco, Mexico, they come with the anticipation of selling drugs for 5-10 years, making enough money to support themselves for the rest of their lives. And within their community, their mothers are very important. That's just part of their culture. So when they would come and they would be arrested and they would be told that they have 5-10 years, maybe even 20 years of a conviction, that's no big deal. They still get to go home and they get to see mom. Now, if they get a murder conviction, they're not going to go home and they're not going to see mom. Were going to be in prison for the rest of their lives. Now that played a very big difference when they're being charged, and things were happening where they were telling on other drug dealers. And so it changed the way that the investigations were being done. And that just changed within the last year.
Interesting. Thank you. What opportunities exist for job placement assistance for those recovering so they don't revert back to a life of crime, theft, and drug use?
None. I'm just kidding. That's a joke. All right. There's a list. I know that Carol, are you working on that too? Are you not working on? Yeah. Carol's, I don't know if you guys know Carol, but she's amazing. This woman has changed my perception on some things. We're trying to get resource lists available. The problem is that things change. By the time you get the resource list done, something's changed. I did find out too that a lot of private companies that are owned by families will hire felons on a case-by-case basis. My company doesn't usually do it, and they hired me again. and they have opened up their policy a little bit. If it's somebody that's involved with drugs and they're honest about it and their record comes up, usually I get pulled in the interview too and we get a chance to talk to them. And if they got some time under their belt and they're doing the right thing, then we hire them. There's no reason that we shouldn't. If you take the opportunities away, there's really no reason to be in recovery. I can't get a job at McDonald's with my record. So it is extremely tough. I think that we have to focus, in my opinion, we have to focus on getting more people in recovery. If we just flood the places with people in recovery, it's going to be really hard for them to turn everybody down. So at this point in time, it's a really small, opportunity that arises at most companies, But there are companies that hire only felons. There's companies that hire mixed back and forth. So, all my friends that are in recovery today that I hang out with today all have decent jobs because they worked hard to get them. It doesn't come easy. Recovery is not easy. So that's just kind of the outlook we have. But Carol's got a bunch of resources on it, yeah.
One of the things that we've been working on with Community Recovery Project is to bring ideas, answers, solutions, whatever we can find from other areas, whether it be in Ohio or a region or national. We had a very large meeting in September in Dayton. It involved multiple medical entities, law enforcement from 8 regions, DEA, U.S. attorneys. The Attorney General was there. We had the coroner's office. At that meeting, one of the things that was discussed is peer navigation. This is when people are in active use and they enter recovery. There's peer navigation systems that have been proven, along with sober networks, to provide the support these people need in order to get a job, because we all know it's very important when you get into recovery that you prove yourself as a citizen, someone who can be trusted, someone who can work a job. So from these peer navigation ideas, I know there's a lot more grants coming through, and a few of them are being applied right now through some of the local medical facilities. The applications are in. Fingers crossed, our region will get some of these. These are the kind of ideas that start. You hear about grants, and everybody goes, great, there's my tax money being spent on some stupid grant. Well, these are the seeds that are planted, these ideas, these concepts. And what can grow from this is actual programs that work. If the grant funding goes through and the program is started and it's proven successful, every single day in our region grants are being used on this type of work. It is very, very important, because I agree with Alex. There's a lot of stuff being thrown around on Facebook right now. It is very important that you understand the need for these grants and these seed programs like peer navigation, so we can see what the opportunities that are working.
This is a multi-part inquiry. What has been your experience with the racial distribution of addiction? How do you attempt to reach all ethnic elements of the community? And finally, how do you change culture?
Okay. I'll tell you right now that the disease of addiction doesn't care who you are. Doesn't matter what color your skin is. Doesn't matter how much money you make. Philip Seymour Hoffman died. Bradley Cooper, Robert Downey Jr. Iron Man is an addict. Doesn't matter who you are. Does not matter who you are. Culture change, that's a really big question. I'm not going to even try to, no way. Go for it.
How do we reach the members, all facets or as many facets of our community? This is a start. The fact that because when you leave, there's always the adage that one person reaches 6. So if everybody here talks to, connects with 6 more people, we've now exponentially grown the message that we're trying to discuss, the issue we're trying to discuss, and what we're trying to accomplish. That conversation that probably didn't happen yesterday helps start that culture change. Captain Mueller exactly said it. We're changing a culture through education and understanding and talking about it and really identifying how important it is to educate ourselves. And we got to start somewhere. Is that the best way to do it? I don't know. but that's what we're doing, and we're seeing some success. We're seeing some results. You know, I love it, you know, the firefighter that gave him a little grief on why are we sending these out. That's what we see. You see some success. You see the benefit. The guys are like, wow, I made an impact. Because if you ask any police officer, any firefighter, why did they start this job? Make a positive impact in their community. Over time, you realize there's not as much chance to make that positive impact as what you envisioned when you started. And now we're going to give them that opportunity to do it again. We have this rough kind of exterior, macho ego thing, but quietly inside, guys are like, yeah, wow, I made an impact. That's a smile. That's a conversation. That's that good thing that happens, so we can remember that for the rest of our life. Because you ask everybody that those kind of stories, they remember those. So that's how we're going to change a culture. How do we change a culture within the community? As we engage our community, we let them ask questions. They let them know what we're doing. We partner together. And you know what? We make a difference. I mean, we are changing a culture. So the question is if. It's not if. It's just a matter of the process. We're changing the culture.
And I'll just touch on that from the fire department perspective, and I can elaborate a little bit more on what I meant when I said we needed to change the culture. I kind of touched on it a little bit. I was kind of hoping someone would ask that question, actually. Thank you. Whenever we have these little success stories, I make sure that the guys, we know who handed out those packets because they're recorded. We know who handed them out, and it's very easy to go back and look it up once we have the information. But each success story we get, I make sure that the guys that handed out the packet, they know about it. I send out a department-wide message that says, hey, so-and-so handed out this packet. I'm sure when they handed out that packet that they weren't aware of really what they were doing and getting these people connected to the resources. Nor did they probably believe that that person was going to reach out for assistance, but they did. And so when these guys start hearing those success stories, they start buying into it. And that's how you change the culture, one run at a time. You know, another guy had asked me, well, there's so much of this stuff going on. I'm going to hand out a packet to one person. And I heard this phrase the other day, and it stuck with me, and I repeat it to myself 30 or 40 times a day. That phrase is, do one for what you want to do for everyone. And if we do that one run at a time, we're going to see some more success.
Again, we're discussing the culture and who is impacted. That was a question. Some of the research. White men and women comprise 90% of those using injection drugs in Cincinnati with an average age of being 23. In Hamilton County during 2012, approximately 800 clients were treated for opioid addiction in the Hamilton County public system, with 51% of those clients being white females, and many of whom were pregnant. In Colerain Township, we could hit the age range. We've had 60 years old, we've had 20 years old, we've had teenagers, we've had 46-year-olds. As Alec just said, it's everybody. It can be. There's a picture in your mind, and it could be of any age, any sex, any background, and it's what we're dealing with. So it's not discriminatory, that's for sure.
And real quick, too, I was at work 2 weeks ago, and this lady I work with, I respect her. She's way up here on my list. And she approached me, and she said, you want to go to lunch today? And I was like, I don't even know you that well, you know what I'm saying? But I know I respect her. And she was like, please, can you go to lunch with me? And I was like, sure. So we went to lunch or whatever, and she broke down at the table, and she said, I can't stop drinking. I need help, this and that. And I suffer from what you guys suffer from, which is the stigma and the picture of who an addict should be and all that stuff. I didn't think this one was an alcoholic for the life of me. But she got 2 weeks sober just because she reached out. You know what I'm saying? So, and when she told me, I was like, what? I couldn't believe it. And we went to Cancun, which is like the worst restaurant for an alcoholic, too. So I couldn't believe that she said it to me. But, I mean, everybody suffers from it. And you know, she's got kids and a house and everything else. The difference between heroin and alcohol is that alcohol, I mean, you can go 40 years of using alcohol and keep it together. I'm grateful that mine was heroin because heroin hit me, and within 3 years, I was on my butt, locked up. The cops had me locked down. There was no escaping what I was suffering from. So there is differences in how long it takes and everything else and what people look like, but usually heroin, it attacks the body a lot harder than alcohol does too, and it's faster. So it's all, you know, there's no big difference, but you know, with people, it doesn't matter who they are. And I see this here where it says, you know, white men and women comprise 90% of those using injection drugs. I mean, that's a lot. That's a significant number of, you know, white men and women, but I'm sure that, you know, some stats are different in other parts of the country too. So it's targeted, correct? Yeah.
Here's questions that are similar in theme. I'll read them together. Where can I get, why do I want to have on hand the Narcan? What is Colerain's stance on the issue? And what's the effect of the addiction, what's its effect on the addiction problem long term?
First, I'll address naloxone or Narcan. As an immediate effect, it saves lives. If people are dead, we can't get them into recovery. We can't find answers for this epidemic. And I have seen this as well. You're not going to kill off every heroin addict. You're not going to kill every opioid addict. They're still going to be here. The medications are still being overprescribed. We are going to not get rid of this problem by arresting our way out or having all of these people die. So that's where naloxone comes in, the Narcan. And this medication reverses the opioid respiratory depression. That's all it does. You can't get high. It will not cause a buzz. It will save your life. It allows you to continue to breathe. That's it. And it's short term. So the person who gives it has to call EMS. Absolutely every single time. You have to call EMS first. Then you administer the dose. In the state of Ohio, a third party can be written this prescription, which means anyone can get it if they go to a physician and say, I want this script. They write it to you. It goes through your insurance. It might not be for you. You know, and the argument is, well, a person never ODs around their family. They never OD at their house. They only OD when they're out with their friends who are using, and that's simply not true. There are many lives that can be saved by this medication. I personally think it should be in every first aid kit. It should be in every school. It should be in every facility. It is a very benign medication. It can only be used to reverse the opioid overdose, period. You can get it. As I said, any physician can write it. The grant funding for this is running very short right now. They're supposed to be putting more money into this program. We're looking for it. PAR Northern Kentucky, I can give you a name and phone number. They can get it for you. It's $52 for a kit. Hart Pharmacy and Delhi Kroger Pharmacy carry this medication. They stock it. So if you walk in with a prescription, you can get it within a half an hour. We are pushing very hard because the other pharmacies are not carrying this medication. The state pharmacy board says there's no reason why they shouldn't be carrying this medication. The retail pharmacy rep for Southwest Ohio says they're carrying it. Well, guess what? They're not. So she's working on this issue as well. But it is accessible. You can get a script for it. Anybody can get a script for it. And you should. If you have anyone in your life, and even if you don't, personally, I would keep this in my car. I mean, I've seen people OD when I'm at, you know, an event downtown, on a sidewalk, on a street corner. So my choice is to help that person breathe again and call EMS and hopefully get them some help.
Okay, what's the township's position on that? We're researching the use of Narcan by the nasal, by our first responders, our police officers. One of the concerns we have is long-term sustainability. It's not whether it's going to be successful or not, because we sit and listen to Lorain counties and Claremont counties, and we heard the success stories. And I heard this comment, and if you're breathing, there's hope. And our goal as a life safety responder is to save lives. If we save a life, then we give you hope. Because why? Because we have now time. And so what's the long-term funding issues associated with this? It's an expensive piece. You know, Captain Mueller could tell you it was $4 for Narcan several years ago. Now it's close to $30. And it's just continuing to go up. You know, I guess if you have stock in that, you can make money. But the reality is it puts tremendous burdens on local first responders on how do we keep it. We went for a period of almost a month where we were out and waiting on a reshipment. It's a legitimate concern, but that it gives me a greater need. Our first responders, our police officers need to have that. But we just need to work through the dynamics. Again, what are we talking about next Tuesday as a group, as a collaborative? That's what we're talking about. The other piece that we want to, as a collaborative, we want to support Carol's initiative to fight and make sure that this naloxone is available at the facilities in our community, so our families that live in the township that serve, we want to help her with that fight. So if you have a prescription, you can get it. You can, and if you need it, you can get it. As you learn, you realize what it really means. It's part of the life-saving process. So we support that. We want to figure out how we can be help to Carol, and we can take care of our community. So hopefully there'll be something that says, you know what, we're doing it because we're working on that.
Right back.
I did forget to add tonight, we have someone here from Center for Chemical Addictions and Treatment. They can get you a script. You talk to them, and you know they have a physician who writes for that tomorrow night at our People Advocate. They're over there.
You want to stand up?
Steve Walkenhorst is here, and he can help you with that if you have any questions.
Thank you.
Tomorrow night, People Advocating Recovery, Southwest Ohio, 6:30, Glenway Crossing. We have a meeting. We will have a physician there who is writing scripts for naloxone as well. You have to get the training. Takes very little bit of time, and then you get the script, and then you can take it to the pharmacy. It's that simple.
Real quick, I believe today, and correct me if I'm wrong, but were they not trying to approve the House bill in order to allow pharmacies to, without a prescription, give out the naloxone? I do believe that I've heard that.
It did pass the House. It still has to go through the Senate in the state of Ohio. So yes, there is a House Bill 04, and that House bill will allow pharmacists to dispense without a prescription the naloxone. So that we still have a little ways to go on that, but I will tell you the legislators understand the urgency of this with the number of people who are dying from not having this drug accessible, and they are pushing hard to get this through as quickly as possible. This is one of the quickest moving bills they've seen.
Here's a couple family-related questions, so I'll read them together. Everyone says the addict has to hit rock bottom. Can a family member have an effect before rock bottom? Related question, what role does a relative once removed have to handle supporting a loved one without enabling them?
Okay, so I don't. This is just my experience. Once again, that's all I can talk to you from. Is my experience. I don't believe in rock bottom. Rock bottom is death for me. I am in recovery today. But there's nothing stopping me from leaving here and hitting a bar on the way home. Okay, my grandpa owns Trios right here in Colerain, which I'm sure the police officers know all about. But there's nothing stopping me from going there instead of going home. And if I drink tonight, it leads to dope for me, and dope leads to death. So there is no rock bottom. You have to manufacture a rock bottom. And that was manufactured via education support, consequences, all the stuff that led me to my first time understanding who I was, if that makes sense. And enabling is it's a balancing act. My nonprofit does family support groups. That was the biggest thing I wanted to happen because I got a shot at recovery. My parents didn't, which sucks because recovery is incredible and they just don't understand it, but they do now. So they enabled me out of love, and that's not a crime. And you shouldn't feel ashamed about it. What you should do is educate yourself, which there's a lot of resources out there for family groups. There's counselors that specialize in it. I know that the rehabilitation center that I went to twice, they had family day where people would come up and they could ask questions and stuff like that. So don't be ashamed if you're enabling somebody. Don't be ashamed if you've done it in the past or anything like that. It's normal. It's very normal, and it happens a lot. It's a question that's always asked. So you guys have family members involved. Do you want to answer on it?
I think the enabling question as well as the rock bottom question Alex answered very well. Rock bottom for heroin is death. And I do believe as far as enabling, there's a process that people involved who is with someone who is affected by this, you should have a support group. You should get support yourself. This disease makes the family sick, not just the addicted person. So Al-Anon, Nar-Anon, not one more.
Well, I'll just pass this on, and I'm not speaking from, but before we left the summit yesterday, Jennifer and I were stopped by a woman that I taught in college. And she said, I just want to remind you of one thing. When you do this tomorrow night, I applaud you for doing it. Just never forget the families. The families are lost. I was there. She was the parent of a heroin user, and she struggled with that, and she's exactly what you're talking about. And she felt like she was lost, and she felt like she was doing wrong. She felt like don't forget the families. We are a part of this, but we don't know as much as we think we know. We just want to love. And is there anything wrong with that? Absolutely not. So they all said the right things, but that was funny. That was the last thing that we received yesterday as we were walking out with somebody that knew us and grabbed us and said, just remember, don't forget the families. So.
Another question related to the type of people with addiction, this related to age. What is the age range of addiction? And if given pain pills, is there a minimum age that individuals are given these pain pills?
Well, I'll take part of that question. As far as the age at which people are addicted, the majority of people that are addicted are young. The population of people that are dying are typically between 45 and 55 years old. But in comparative relation to the general population, they only make up 1% of the addicted population. However, 18 to 25-year-olds, they have, I believe it's like 7.9% comparative to their population, they're addicted. And 3.9% of 12 to 18-year-olds have their population addicted. So more addicted people are younger, but they're not seeking treatment. For one, they're not seeking it because they don't believe that they're addicted, and they don't think that they need help. And so that's a very big problem because while they're not the ones dying, they're definitely the ones that are seeking. First, they're trying drugs for the very first time, and they're quickly becoming addicted because their brains are not fully developed. They don't develop until the age of 25, which explains a lot of adolescent behavior. But they are 5 times more likely to become addicted than adults, and so that's when addiction becomes very quick. And so that's something that is so important for prevention. And so we need to get to the kids very much sooner than we have been traditionally. And so that's the piece I'd like to, and then I'll pass on.
Specific to Colerain Township, 15 to 66.
Yeah.
Our youngest and our oldest. And I just went through that data not that long ago. I was fresh off the top of my head. I just wanted to search and I searched all of our runs and grouped them by age. The youngest was 15, the oldest was 66. 15 to 66, I was told to talk louder, sorry.
Okay, it is 8 o'clock. It's 8 o'clock. There's questions there. We can, not really sure, I know what we were talking about. I know how we want to handle this, and we respect your time. We respect Danielle's and Alex and everybody that's here. I know there's questions that need to be answered that you may have asked. Well, as I explained, Kevin, we're going to take the information we learned tonight as our collaborative. We're meeting next Tuesday. We've invited a trustee to come on board. Some of the issues, the naloxone, the syringes, the response, the follow-up, all those things, working with our local pharmacists. Anything that this collaborative believes is the direction we need to go, we're going to work through it and try to identify support within the community to make sure that we can provide the services that are necessary for our community. So this is, again, not the first step. It's a step along the process, and we're going to continue to work on this. So I just want to thank everyone for giving us your time and appreciate the fact that you you came out tonight.